This rainbow in Haiti marks the beginning of new hope for Haitians, as our Haiti Medical Project expands to be a whole-person health ministry. Our foundational program is mobile clinics, visiting communities where Brethren congregations emerge. Now, long-term health projects are the building blocks of a promising future for Haiti. Return visits of our mobile clinics provide both continuity of healthcare plus the emotional and spiritual healing of hope. That new hope allows villagers to envision a promising future: clean water, improved agriculture, increased chances of survival for birthing mothers and children, and access to medication. These villager visions are now our rainbow of hope, a spiritual calling for more partnerships in the continuing work of Jesus. Our partnerships began as Church of the Brethren Disaster Ministries built trust and homes in 2008 after hurricanes hit Haiti. Again in 2010, when we responded to the earthquake, Brethren created partnerships with Haitian and U.S. medical personnel to form mobile clinics. The leaders of our Haitian Brethren immediately recognized the power of this ministry, and with help from the mobile clinic team, sought a plan for an all-Haitian medical team to continue the clinics. That plan became Haiti Medical Project in 2011 as a partnership between Église des Frères, the newly started Church of the Brethren in Haiti, and the U.S. Church of the Brethren. As Église des Frères congregations continue to host mobile clinics for anyone in their community, they are distinctively known by the manner of their living and are growing rapidly. We can see that new churches, new hope, and new visions of community development are resulting from Église des Frères leadership faithfully answering God's call for partnership. That call extends to our further partnering with Project Global Village in Honduras in order to learn from their 40 years of successful, remote, grassroots development projects. Your support makes possible our translating of their project manuals into Creole and their staff training our community development staff in grassroots methodology. From our learning, we have established this key premise in all of our community development work. The most important thing we can do to be of assistance is to provide opportunity for the calling out and training of local leaders to be change agents in their own communities. Thus, the first step for our staff in a new Haitian community is holding a village meeting where residents identify issues and appoint peers to address those issues in committees that our staff will train. With that same focus on local leaders as change agents, our International Coordinating Committee to the mobile clinics is composed 2/3 of Haitians. For the glory of God and our neighbor's good, many individual brethren and congregations in the U.S. partner with us. We have hope that everyone watching this report of new community development will consider a new partnership with Haiti Medical Project of prayer support, time, talents, and money. Donations can go to Church of the Brethren Core Ministries or directly to Haiti Medical Project. Together, we are answering a call for a rainbow of hope for Haiti. Good news of whole-person health, building trust, empowering local leaders, drinkable water, thriving agriculture, vitality in maternity, affordable medicine, accessible health care, all in a context of gracious Christian love. In the Bible, the rainbow inspires hope as a sign from God of the promise to never again destroy the whole earth by water. Though surrounded by water, there is a shortage of drinkable water in Haiti. This hopeful rainbow came as Haiti Medical Project began its drinking water program. Clean water is an important part of our rainbow of hope because as the poorest country in the Western Hemisphere, polluted water is the leading cause of child illness and infant mortality in Haiti. There are almost no sewage sanitation systems, so Haitians are prone to cholera, typhoid, hepatitis, chronic diarrhea, intestinal worms, and other waterborne diseases. Without municipal water, Haitians rely heavily on tanker trucks that carry drinking water for merchants to resell. Many people do collect rainwater, but cisterns for long-term storage are too expensive for most Haitians. Fortunately, drinkable water can be made with a low-tech sand filtration system along with simple chlorination techniques. We partnered with a volunteer consultant to train our staff in construction and maintenance of this type of water system. St. Louis du Nord Église des Frères now uses water purified from their cistern to serve over 350 students from this growing school, which is run by members of the Church of the Brethren. In a remote area, high on a mountain, this filtration system collects rainwater from the roof of the Morne-Bellage Église des Frères. These brethren will sell the water for a nominal fee to help make the water available more widely in the community and to ensure the water is valued and not wasted. At Gonaive Église des Frères, this water well is funded in partnership with the Global Food Initiative of the Church of the Brethren. Though the water is too salty for drinking, it can be used for cooking, washing, gardening, and livestock. The sand filter cannot remove the salt, so we are partnering with a volunteer consultant about technology needed so the church can provide drinking water in the community. These 3 churches, and many more, can truly become sources of living water in their communities with the contributions of our volunteer consultants and our financial partners. Join our Rainbow of Hope for clean water and better health in Haiti, as it also promises to bolster the lives of Haitians through improved agriculture, including gardens to improve diet, as well as crop and animal projects to boost low family income. We are further partnering with Global Food Initiative for training in animal husbandry, water and soil conservation, soil rejuvenation, and improved methods of gardening. Please consider becoming a spiritual partner with us in order to improve agriculture and supply clean water that will contribute to the overall well-being of Haitians. When Haiti Medical Project began with mobile clinics, we could only dream about today's rainbow of hope that illustrates our expansion into a whole-person health ministry, including a focus on maternal care. Haiti has the highest infant mortality rate in the Western Hemisphere, plus an elevated mortality rate among women giving birth. To promote vital maternal care, we started Mothers Clubs and training for birth attendants. Our Mothers Clubs are modeled after the success of our partner organization, Project Global Village. Our staff nurses lead discussions on pregnancy, nutrition, childcare, family planning, and especially personal hygiene, including washing hands and toilet habits. Instruction is also important regarding the use of clean water for bathing, food preparation, and drinking, because even before the 2010 earthquake, 16% of child under 5 deaths in Haiti were directly related to waterborne diseases. In addition to training about matters literally of life and death, the clubs will be a social occasion for the women to eat together, pray together, and learn from each other about child rearing. Our nurses will weigh and measure the children up to age 5 in order to chart their growth, give advice, provide multivitamins, and make interventions when needed. Another vital project for maternal care is training for matrones. Live births with a doctor present are virtually unheard of in Haiti. Instead, most births are attended by matrones, local persons with some experience in attending births, but no medical or sanitary training. We are partnering with a well-respected organization, Midwives for Haiti, to train our community development nurses in leading a short course for local matrones in the communities where we are working. Matrones sharpen their birthing skills and learn the basics of good sanitation, problem situations they may face, and where to get emergency help. Upon completion, matrones receive a birthing kit containing gloves, blades for cutting the umbilical cord, and other small items useful in assisting a sanitary birth. These matrones trainings combat the rates of mortality for both infants and birthing mothers. Consider partnering with us prayerfully and financially for the sake of Haitian mothers and children who will also benefit from the other colors in our rainbow of hope. This rainbow in Haiti serves to remind all of the partners of Haiti Medical Project that hope comes not just from our well-laid plans, but from trusting God, even when we hear a call to change. Remote community health committees were asking for a small medicine dispensary in their communities. Some are so remote that regular mobile clinic service is not yet practical. We learned that the only alternatives for medicine are a full day or more walking to a pharmacy, or simply going without. Hearing this request as a calling to make a change, Now, the most commonly needed medications are available at quite modest cost right in these remote communities. In order to staff a dispensary, volunteers from the Community Health Committee receive additional training to recognize and treat minor acute medical needs. Our program leaders are excited about this way of having more impact on the needs of our most remote communities. Our willingness to listen to villagers and be discerning about the new directions God is leading us have led to all of the other colors of the rainbow of hope, when at first we had only the red and purple hues. We have discerned that our donor partners will create greater impact when mobile clinics are paired with community development projects, which are the blue, green, yellow, orange, and add to the purple hues in our rainbow of hope. Why? These community development projects provide preventive medicine, which means there will be less visits to mobile clinics. Yet, the mobile clinics will continue. As our capstone of care, they play an important role in creating access to professional medical care for persons in remote areas who would otherwise never see a doctor. The ability to now move our mobile clinics from the first and only step in remote Haitian healthcare to being the capstone is the strength of the preventive care building blocks that will uphold our capstone clinics. From the profound effect of preventive medicine, the power of donor dollars are maximized. More people have more quality of life for longer lives. There is a more lasting impact on communities, less people needing the mobile clinics, and the mobile clinics becoming more effective in treating the most serious illnesses. Becoming a whole-person health ministry in partnership with the local church is the most effective and faithful way for Haiti Medical Project to participate in God's good news to Haiti. Expressing Christian love as building trust, developing leadership, providing living water, training for thriving agriculture, empowering mothers, resourcing affordable medicine, and making healthcare accessible are the rainbow of hope, our call to continue the work of Jesus in Haiti.